Hello, everyone. Welcome to this DecisionWise webinar, Understanding the Employee Experience Before, During, and After COVID-19. My name is Justin Warner, and I'm the Vice President of Sales and Marketing here at DecisionWise. We're really grateful to have our guests here with us, and let me just take a couple of minutes to introduce each one of our guests. First, we have Adrian Cozart. Adrian has been in the human resource industry for more than 30 years and currently is the Senior Vice President of Human Resources at University Medical Center in Lubbock, Texas. She's active in her community with the Texas Workforce Board, the Girl Scouts, Workforce Solutions of the South Plains, several women advocacy groups, and Goodwill Industries. I think this is really cool. Adrian was honored with a plaque that permanently resides in the MLK Memorial located in May Simmons Park, entitled Footprints of History, as being a trailblazer in the Lubbock, Texas area. She has a master's degree in business administration and is a doctoral candidate for a doctorate in business administration with a human resources human resource management, excuse me. Adrian, thank you so much for being here with us. And next, I'd like to introduce, Next, I'd like to introduce Liz Fuchs. Liz is the head of HR and talent development at the Association for Talent Development, or ATD, based in Washington, D.C. For nearly 80 years, ATD has supported those who have developed knowledge and skills of employees and organizations around the world. Many of you on this call are associated with ATD and are familiar with what ATD has been doing with certifications, workshops, research, publications, training, learning, and development. If you haven't and aren't, and you're on this call, you should be associated with ATD. So make sure you do that. Liz has, prior to her role at ATD, she served in various roles with Lockheed Martin, MITRE, and the U.S. government. Liz, thank you so much for being here with us as well.
Thanks for having me, Justin.
Great. Darren Ali is an experienced HR and talent management diversity leader working with Calypso Technologies in London. He has a history of working in banking, investment management, and financial technology, the financial technology space. Currently, as I mentioned, he is the global head of HR and talent at Calypso. Calypso is a leading software provider of front-to-back technology for the financial markets. They are used by over 34,000 market professionals in 60 countries, representing more than 180 financial institutions across all regions. Prior to Calypso, Darren spent 8 years with BlackRock, the biggest financial asset manager in the world. The earlier parts of his career were spent in banking across multiple HR disciplines, but has specialized in employee engagement. Darren is a husband to his wife, Catherine, and his son, Rice, and their daughter, Isabel. Darren, thanks so much for being here with us as well. All the way, Darren's staying up late for us, so really appreciate that. Also want to introduce Trent Savage. For the last 18 years, Trent has been working as a progressive HR leader in industry-leading companies. He currently serves as the Chief Human Resource Officer for Mountain America Credit Union in Utah. Prior to joining Mountain America, he held an HR role for a technology company called InContact and helped it through its acquisition of NICE, or the acquisition to NICE, excuse me. He's worked at Amazon, where he managed over 100 HR professionals, as well as worked at eBay as a senior HR director of global customer service, and at Procter & Gamble, where he was assigned to in the Philippines as the HR for P&G's Asia region. Trent is passionate about partnering with business leaders to provide clarity in business direction, alignment of goals, and to create high-performing organizations. This is something he cares really deeply about and wants HR to be something more than, I liked this phrase, Trent, carrying watermelons at the picnic. Trent has both an undergrad and an MBA from Brigham Young University and resides in Alpine, Utah with his wife, Jamie, and their 4 children. All right. Lastly, let me introduce Tracy, who will be moderating this. Dr. Tracy Malett is the CEO of DecisionWise and the author of the best-selling books, Engagement Magic, 5 Keys for Engaging People, Leaders, and Organizations, and The Employee Experience, How to Attract Talent, Retain Top Performers, and Drive Results. Dr. Malett has a passion for leadership development through education, performance, feedback, and coaching. Dr. Malett received his doctorate of organizational change from Pepperdine University with an MBA from Brigham Young University. Dr. Malett is a professor at the Marriott School of Management and a member of the American Psychology Association SHRM Academy of Management and ATD. So excited to have all of you on here. Thank you all for being here. Tracy, I'm going to go ahead and turn the time over to you to let you moderate this discussion. I'll come on at the end again to wrap things up, but thank you all for being with us.
Very good. Justin, where else do you get a powerful group like this on a webinar? This is fantastic.
I don't know. This is a powerhouse.
Yeah, my thanks, sincere thanks to our panelists. You'll see this level of expertise as we go through here. There's a reason why we have, several hundred people that registered for this webinar, and then we'll have, triple that access it afterwards. It's because this is a very hot topic right now. And one of the things that we wanted to do was make sure we had a diverse group on here in terms of their organizations to be able to help us understand what's going on right now with some areas. Let me set some tone here, and then I'm going to turn the time over to the group. And my role will be to kind of ask questions and moderate this. You'll see me looking off to the side. It's because I'm cheating with some notes. Our team had done some recent research, and many thanks to our analytics team in terms of engagement for these results. But there's some interesting statistics, and I'll just share a couple of these that I shared in our previous webinar just to kind of set the tone. I won't go through all of them. I'll give you an idea. What we were trying to do is understand what's happening to the employee experience during this COVID crisis that we're experiencing. What's going on with our employees? What's happening within organizations? Our hypothesis was that over the last 5 months, engagement will have decreased significantly. Interestingly, we found the opposite. And so this webinar today is to talk about what's different and what's causing that. Now, that said, I'll give you the after story here in just a moment. In November of 2019, overall engagement hit an all-time 5-year low, actually. It's actually a decade low. In November of last year, when things were supposed to be rosy and things were going well, it was a good environment, and engagement was an all-time low. In the first of 2020, we started to see this trend upward a little bit. Then what happened was COVID hit, and COVID hit hard, and it impacted the employee experience very hard. Engagement immediately dipped. But what's really interesting is what's happened over the last 6 months. In April of 2020, this is a month after COVID hit, engagement hit a 5-year high. Really unusual. COVID, tough situation, engagement overall, and this is in 70 countries, hit an all-time high for us as we measure this. Really interesting. But then the rest of the story, we're seeing engagement start to dip again. Now, there's some reasons why we believe engagement increased. Number one is we're grateful to have jobs. So naturally, we want to say this. But as we did some statistical correlations, there were some other factors. I'll give you 2 of these. Number one, I trust my supervisor. Our all-time low, all-time average, our benchmark, this is with 40 million survey responses. The norm was about 76% of employees responding positively to that. I trust my supervisor. In November, that dropped to about 70%. In April of this year, that increased to nearly 87% favorable. That's starting to dive again, unfortunately. Here's one more. I feel like I belong here in this organization. That to us is one of the key indicators of whether people are going to stay with the organization. The norm, average, over the past 5 years has been about 75% favorable. So 3/4 of the employees say I belong here. November, that dipped to just below 67%. In April of this year, 86% favorable. So really kind of interesting what's been happening with engagement. So the purpose of this webinar is to really talk about some of these things. And I want to give a heads up to some of our to our panelists here, because I'm going to ask some questions here that I want to facilitate. And here are the questions. What have we learned from COVID about the employee experience, and what will the EX and engagement atmospheres look like in the future? What have we learned? Question number one. Number two, this was actually one we hadn't anticipated, But as we talk to the panelists, all four of you mentioned something that I absolutely loved this question. Have employee expectations changed? How do we realign those expectations? So we know that as an organization, we have certain expectations. And those expectations have changed, but employee expectations have changed as well. So what do we need to do to realign these contracts that we have with the employees and the psychological contract? Next, what do we need to take forward post-COVID? In other words, what are some of these interesting things that we're learning that we want to make sure continue? Now, the rest of the story with those numbers I presented, one of the reasons why things are starting to go back down is because managers had these wonderful habits to start with for 5 months, very intentional communication, very intentional praising, very intentional feedback. And now we're starting to move down to where we're not doing that anymore, getting back to the old norm. So what are some of those things we want to take forward post-COVID? Final question. What is the role of the manager and the leader in this? And what are you seeing being done right now that's causing that impact to happen? We see that the number one factor right now in those COVID numbers is the direct intentional relationship I have with my manager. It's not the top of the organization, it's my direct manager. So I want to talk about this. All right, so enough of me. I want to make sure we get to the topic here. And because I happen to see Liz on the first of my screen here, I'm going to put you on the spot here. And then I'll ask each one of you. I'd ask you to kind of be brief in your responses, but feel free to talk or respond to others as well. So first question, Liz, within ATD and what you've seen outside, you have a chance to interact with a number of different organizations. What do you think we have learned from the COVID experience, and what does this mean for engagement and the experience going forward? Has it changed it?
I mean, it absolutely changes it. I think one of the huge lessons that we need to take from this is that our communication as leaders with our employees has to be intentional. It was super easy pre-COVID. We were all together in the office. You could, while you walked by to grab a cup of coffee, you're talking to your employees. It's got to be intentional now. And I think when we look at those engagement numbers as they climbed, from April, it was because of that intentionality in how we interacted with them. I think the other thing that we've learned that I really hope we continue is that leadership and management needs to be tailored to our employees. There is not a one-size-fits-all way to lead. And I think we see this right now. We've got employees who are thriving. They love being at home. They love working from home. We've got employees who are struggling. They are trying to be a teacher because they've got kids who are virtually learning while they're trying to do a full-time busy job. And we've got to respond as leaders to all of the different circumstances that our employees are in. So really customizing and tailoring that leadership for them. So when I think about what needs to go forward, those are the two big things.
I love that response, because what you've not done is you've not put this on the top of the organization. The top of the organization cannot understand the individuality, the individual interaction. And for this reason, I think the managers and the leaders, line level leaders, play such an important, crucial role. Trent, I want to ask you that same question. May I ask you that same question, Trent?
Yeah, you bet. First of all, I would totally agree with what Liz has shared. I think, it's such a unique time for all of us. And my hat's off to all of you that are on the phone today that have gone through this, and especially those that have been leading through it, because one of the things that's been unique is we have been leading with something that we have so little information on that's changing so fast. So one of the things that I think is critically important is data, right? How do we get good data to inform us? And there's two ways to look at that, right? The external data, because of what's happening in the marketplace or our environment. The second thing is our employees. We've had to increase our, pulse checks, whatever you want to call them, with our employees to get a feel of how are we doing, as we launch some things and get them out there. How are they reacting to those? One of the things I've really appreciated about what we've learned with COVID is that it's blown up the notion that organizations can't be successful with employees working from home. I'm sure many of you have had or have maybe been leaders that have had that mindset, and this has blown that out of the water, which I'm grateful for. We had a desire to push a lot more to mobile communication, allowing employees to work remotely. I was just meeting with my CTO yesterday. We were both talking how we wanted to move more to remote, but this just accelerated it. And so I think that what it comes down to is really being thoughtful on how are we using data. I think that's something we've had to do in the current process. I think it's something we're going to have to be thoughtful about in the future process. I would 100% agree around the communications, right? And there's two aspects to that. There's the general leadership, and then there's also at that one-on-one with the manager and the team. I think a lot of our employees that work remote, they work alone, man, they crave that team collaboration. And we've got to be really thoughtful about how do we engage somebody just graduated from college living in an apartment by themselves, right? I've got a niece, for example. She's moved out on her own, just graduated, but she's asked her parents, can I come work at your house? Because I don't want to sleep, eat, work, and everything alone all the time. So I think we've got to be thoughtful about social engagement with our teams and how do we go about that. I think the last thing is just how do we, continue to ensure that we're driving, this balance between delivering the business and engaging our employees in a different way. That's been a unique challenge. My personal belief is, which we can talk more about this later if wanted, but I think that the companies that come out of this and think about a restructured workforce in terms of remote work in the office, and how they go about it, those that do it well are going to win and attract talent. Those that don't, they are at high risk, in my opinion, of ongoing survivability with the employees.
Trent, along those lines, I love the way you phrase that with the two aspects that we need to be considering. Our employees engage, but engagement isn't just feeling really happy about their jobs. It's actually producing and being effective. You're in a unique environment. In Utah, unemployment is 4.5%. That's really low unemployment still in an environment like this. So we haven't lost the focus of needing to retain these employees, but also the ability for employees to deliver. So we're going to address this a little bit later on. I'd love to hear some thoughts on this one. I'm going to go to Darren because, Adrian, I want to say last on this one because you're in a unique environment which is not remote. And I want to talk about that here in just a moment. So, Darren, tell us a little bit about that. What have you learned from COVID? What do we need to learn from COVID? Mm-hmm. What will engagement look like in the future and the experience?
Yeah, and I love that question. So, look, we weren't ready for it. We're at 23 countries around the world. We saw COVID happening in Asia Pacific. We kind of saw it moving. We just weren't ready for it to move as fast as it did. And so in a very short period of time, we went into fully remote. I don't think we'd ever done a full business continuity test to be fully remote. So we didn't know how this was going to play out, but it forced us to, do a few things. I liked your language, Liz, around intentional. And I would just use intentional, then ... I mean, just about everything, but communication being one thing. And we saw some success, which we'll try and continue in a few things. We learned a bit about ourselves. So our written communication changed. It became much more human. So just to put that into context, we were writing communications in the early part of, certainly from March onwards around, look, colleagues, remember your other colleagues. You're going to see them on video screens. They might be unshaven. Their hair might be disheveled. They might be in their pajamas. There's going to be kids running. A kid might jump on them. Their wife or husband or partner might be in shot. The dog might be barking. Be patient. And we haven't done communications like that before. And we were getting unsolicited positive feedback around that tone in the way we were talking. So we'll continue that. I think we will continue doing some of our group communication, all hand type meetings. So we actually changed the name to Ask Me Anything. So every 3 weeks, our executive committee meet in a virtual environment in their homes. The whole company joins. We did a few things different. We used to just do one and record it when we did all hands. Now we do one in the morning, one in the evening to accommodate better flexibility for people. Why should one group have a recording versus a live experience? Light on PowerPoint and had it interactive to take questions through the meeting. But the things I think we'll try and take into the future were vulnerability. So hearing our CEO say, I feel scared, was something different, which people really responded to. It was true. He wasn't lying. He just was laying out exactly how he was feeling in that moment. How we talked about some of the things we were doing to help people. So as an example, we created a disaster relief allowance, which is a terrible, very dramatic term to use. We had to call it that to get some favorable tax treatment in certain countries, but it was an allowance monthly paid to everyone, not for hardware or tech equipment or a seat, any of that you got. This was about, you might have had electricity bills go up. You might have updated or upgraded your internet connectivity to get it faster. All of that is true, and normally we would stop there. But just by adding this bit, you might want to just upgrade your Netflix account to put it on more devices because your kids are at home. Adding that little touch humanized us. And so there was a lot of work we did around how we communicate in those types of environments, which I think will continue. And then the other thing I'd say, two more things, and then I'll let someone else speak. How we approach supporting people in terms of tools, whether it's an FAQ on managing remote teams, managing your own well-being, because we saw spikes in at first we saw great spikes in productivity, but we also saw people working crazy hours. And so we put a lot of tools in place, and the learning for us, I think, what we take into the future is build the right tools, but at speed. And what I mean by that is, before COVID, we'd want the platinum version. It'd be, we'd spend weeks getting it, maybe 5% marginally better. The reality is it doesn't need to be perfect. It just needs to be good enough. That's how we feel now. So I think we go into the future thinking about build something that's good enough and could get adopted quickly at the point people need it, because that's where we saw some spikes in the experience. And then the last one, which I think I could have predicted a little, but not to the extent we saw, and this is linked to communication and connectivity, is grassroots activity. So very quickly, we saw people realizing, I'm now in a virtual setup. I need to know how to connect with people. I could wait for the organization to solve that problem, or I can go solve it myself. And so we saw virtual coffees, virtual lunches, virtual happy hour, virtual wine tasting, virtual book club. All of this stuff was self-propagating on its own. And I think going into the future, what I'd want to do is try and make sure we can continue to unlock that and tap into it.
Wonderful. Wonderful. Thank you very much. It's, we've talked, all of you have mentioned in different terms that intentionality that exists, that need to focus on those things, where in the past, it was just kind of a given. These things happen or they don't happen. Now it's much more intentional. I also appreciate the idea of the authenticity, the humanization of what's going on here. We talked about this a little bit earlier. I don't know if you saw the video, it was several years ago, but CNN did a report, and they had a reporter that was in the UK, an expert, and the expert's little child ran in the background, and you see the nanny drag that child off, and the child doesn't want to go, and he's trying to hide all this stuff that's happening in the background. I'll tell you, of the last 10 coaching calls that I've had with executives, I don't know that has not happened in at least one of these every single time. People show up in their workout clothes, say, hey, I'm sorry, just got done working out. The idea that you mentioned, that we no longer stress the PowerPoint presentations, it's about authentic two-way communication. Good. I want to come back to that in a moment. Before we do that, Adrian, you have a different perspective from all of these individuals because you have not moved like Darren has to 100% remote work. So tell us a little bit more about what you're learning, what your organization has learned from this experience, and what do we need to take into the future?
You're right, Tracy. Healthcare is a lot different animal. And we did have some staff that we were allowed to work from home, but that was only for a short period. And we had to bring those employees back. But what everyone has stated about the communication, about the data, about the things that we've done to motivate our employees, the thing that we have here at this hospital, we had engagement that has been at the 95th and 100th percentile for the last 7 or 8 years. And so we have an engaged staff, we have engaged employees, and we learned a lot more that our employees are really more engaged when you have to deal or handle COVID patients that come into the hospital. No, we weren't prepared. for them. We had to set up units. We had to change people's staffing around. We even had to go back and pick up nurses who haven't been in nursing care for over 25 years to retrain them. So with everyone's conversation, the thing that I think that summarizes what we have as our motto here is service is our passion. And we had to go back and really feel what was service is our passion. And when I look at how we communicated, we increased our communication. We put all types of incentive in. We've given funny videos to help people, even wearing masks. We have our own video because we do our own production here at the hospital. The thing I think that summarizes all of our conversation is that we have intentional compassion. Not only is it intentional for the patients that we serve here, but we had to have what was the compassion that we have for our own employees, the long hours that they had to put in, the inconvenience of not having childcare, where we opened up our own childcare services to make certain that we took care of our own employees. But if it was just a simple meal too, all summarized to be the compassion that centers around service is our passion. And what were we going to do to make certain that our family stayed together? And it was the compassion from the top to the bottom to the cross line, from the managers. We all stepped up to the plate and continue to step up to the plate to make certain that our employees stay engaged and know that we care for them.
Adrienne, I know your organization well and know the leaders of the organization. This is something that's always been there with UMC, that compassion, that love. Part of it's because you're in healthcare and that's natural, but I see this more in your organization than I see in most any other organization. But what I hear you saying is that's even increased multiples during this particular time, showing that's the case.
Yes, and why are we doing all the things that we're doing for our employees to engage them is because we do care about them and we want to make sure that they're motivated, even if they're working from home or they're here in a hospital setting, that they have to be here every day because they cannot work from home. But they also have family pressures. We have teamed with our American Cancer Society on their Hope Lodge, where we are offering employees housing in case they do run across COVID in their own homes. Where can they go instead of paying a hotel? We have that Hope Lodge. It's free lodging that offers them from kitchen services to pots and pans to sheets, linens, whatever they need to make certain that they get through. So again, I keep trying to bring back all the things that we've talked about. We do it because we are compassionate. We're passionate about our employees and what the life changes that we're having to make, and no one knows what those changes are.
Wonderful, thank you. And I want to keep on that train of thought here. And the next question I'm going to ask here, but I'm going to give a statistic in the meantime, is what has changed about employee expectations through this? One of the worries as I talk to individuals, and I had an opportunity to speak with you folks before this webinar, is have employee expectations changed? And what do we need to do to realign expectations? What's different that we can accept and what do we need to go back to? Before we do that, I want to hit a point that Adrienne was talking about. And that is the idea that the organization cares about me as an employee. Give you some brief statistics here. Hit an all-time low from the beginning of our database, hit an all-time low back in November of last year, and that was below 70%. So you have a third of your employees that don't think the organization cares. During March, April, May timeframe of this year, that increased to nearly 90% of employees saying my organization cares about me. Unfortunately, we're seeing that start to dip again, that where they don't care about me anymore. Just interesting point to support what Adrienne was saying. I want to move to that next question, which Adrienne brought up. We, and all of you have talked about the idea that we've made some changes as an organization. Now, some changes that have been happening over the last little while, in employees' minds, we formed what we refer to in our books as a new contract, a new psychological contract, not necessarily a new transactional written down contract, but one in their minds that is different. So I want to just kind of throw out the question here a little bit about the employee expectations, or the EX, employee experience. How have employee expectations changed in your organization or worldwide? And how do we realign these expectations? All right, I'm going to let's throw this one at Trent here. You willing to be the first poster child, Trent?
I'm not a very good poster child. I better go ahead and throw this mask on for everybody. So, but I will take a stab at it. A couple of things. It's a really interesting question around how employees' expectations have changed. I think they have, and I think they haven't. And let me tell you what I mean by that. I think the number one thing that has changed that employees are going to be looking for is flexibility, right? Because what this has created is we've shown that we're willing to be flexible with you as an employee, and yet they've shown the commitment to deliver on work. So I think that is a core thing, especially as the remote work continues. I mean, I've had an employee come to us and say, we're selling our home, we're going to go work and live in an RV. Are you okay with that? Well, how do you answer that, right? Because that's new. It's like, well, how do I tax you? I don't even know how to think about that. So kind of an interesting thing around that. A second one is I think our employees are having, I think they've always had this. I think it's accelerated what I call this consumerizing the employee experience, right? Like they want the Amazon, the Uber experience from work, right? Like I want to find stuff fast and easy. And I think what that's requiring a lot of us to think about is how do we use chatbots and other types of things to make employees, make it easy for them to get what they need at their fingertips, especially when they're remote. What I don't think has changed, but I think it's been clarified. Too many organizations focus on what I call the shiny object, right? It's the ping pong table, it's the picnic. And we know this. We know time and time again, it's a nice to have, but it's not a must have. But yet everybody focuses on that. What employees really care about is managers that are leaders that are going to help work with them to set clear direction, provide them the support and the resources to be successful, and help them navigate their career, whatever that looks like, right? And I think that I'm grateful for this experience in the sense I think it's helped leaders kind of get away from that. Oh, okay, maybe, I had a leader before, it's like, well, let's go get an ice cream. Nobody gives a crap if we have an ice cream machine or not. Nobody cares if we have a Coke machine, with multiple flavors. Yeah, they're going to use it. Of course they are. What they care about is, do I have autonomy? Do I have the ability to provide meaningful work, and can I grow in my career? And I think that this experience has highlighted some of that more than anything, that giving those. And I think, and now a new one is flexibility. So I think those are kind of some things I think where they've either changed or not changed, but been maybe highlighted, spotlighted.
Trent, I think that's so interesting because, you talk about that shiny object and how I think those of us that have been doing this long enough recognize it's not the ping pong table. And Tracy, when you talked about that number really peaking in April, to me, like the thing they needed more than anything was knowing that their employer cared about their health. Like that, to me, like that became everything. And as we watch that decline, it's like, okay, great. I feel good about you taking care of my health, be it because you're offering flexibility, or Adrian, to your point, offering housing and things like that. And so that's, to me, like, as we think about, balancing these expectations, how do we not swing back to the shiny object? How do we get focused on that which truly impacts them and makes them feel good, knowing that we trust them and knowing that we're going to care for them? So if someone has that, let me know, please.
I have the question that even though we've learned a lot from COVID, but do we understand our employees? Do we really understand what the expectations are? Because you're right, the shiny objects are great and they only last for a moment in time. Perfect example for us is that we provided employees lunch and it was served by all the hospital administrators. And now when I went to do another lunch, employees' expectation is, are you going to bring it to me personally, or are you going to have the administrators? And so I don't quite think that we have gathered what the expectations of our employees are as we're coming around to this. I think flexibility, yes, is one, and having clear direction, which I think we thought we were doing, but now made it more clear now. But I don't know if we have a clear understanding of what the expectations are once we come out of this.
I think there's another piece of that too, and it's the idea that, and this is one of our learnings from COVID as we work with organizations, we used to try to understand as an organization as a whole. So we do the employee survey, we understand what our employee demographics makeup may be, and we implement an organization solution. And one of the things I hear you talking about is, yeah, it's no longer about an organization solution. It's no longer about putting the ping pong and foosball tables out. It's about an individual, one-on-one, dyadic relationship, understanding that employee, not understanding this organization as a fluffy cloud, but it's understanding Trent as an individual or Darren as an individual, and what is it you need?
Yeah. So yeah, if I could just jump in there, I think that's right. I was listening to you, Adrian, and I was thinking, I actually think we know more about what people want than we ever have, but it's held at the line management level, because they've gone. What I've been impressed with is, and this is one of the things I hope comes out, that you asked a question at the start, Tracy. What is it the kind of standout managers have done? And we've talked a bit about it already. They've personalized. They've made it something they care about. They had to. And so pre-COVID, and it's still the same now. Like Monday to Friday, we spend more of our waking time thinking and work and doing work. At least Monday to Friday. And the person outside of ourselves who is most influential over the type of work I do, the colleagues I have to interact with, my compensation, the development opportunities I get, and my career is my manager. And so if you buy all that, and I would accept that not everyone does, then that is a privilege to be a manager. But that's a big burden of responsibility. And the flaw before COVID, a lot of managers fell into, which is back to the lack of personalization, is, and it's not managers' fault. Managers remember what they're taught as children from their parents or their spiritual leaders, which is treat others as you want to be treated. And so if I meet someone in the street, that's actually really good advice. The only data I have is what I can see. So if I want to have a handshake, that's probably a good way to think, should I shake your hand? But in a management perspective, that one size version of, I'm going to manage you the way I want to be managed. So I'm going to give you feedback the way I like it. I like brainstorming, so I'm going to put you in brainstorming. It's just it's completely counterintuitive to how you optimize someone. So how I'm best optimized is unlikely, Tracy, to be how you're best optimized. And I think that this situation has really it's forced managers to go deep and almost build that user guide to me. When am I at my best? Am I a morning person? Am I an evening person? Do I need help? What flexibility am I going to have? I got a partner who's got an equally demanding role, so I can't do any afternoons because she's in board meetings on Wednesdays. But what's the one thing you can do for me to help me feel a greater sense of inclusion while we're all remote? All of these questions, I think managers, even though it wasn't necessarily natural for all of them, they tried. And just try and got on better. So that's how I kind of think about that. What I hope will be kind of coming out of the back end of this a little. Excellent
points. I want to give a chance for Adrian to respond to that, because there's some things that I need to understand about flexibility in a healthcare environment. If you're a charge nurse and you're working in the emergency room, flexibility doesn't say you can work from home at a given time and come in when you want to do it. There's a certain degree of flexibility that can't be granted there. So putting you on the spot, how do you allow for some of that individualization in an area, in a field where there has to be set guidelines that are very clear?
There's not to be honest with you, there's no flexibility. When it comes to certain areas of the hospital, when it comes down to the OR, I need the OR in place. When it comes down to the intensive care areas, I need employees in place. So there is not a lot of flexibility. So here does come the actual tokens of incentive. How do I continue to incentivize those individuals to stay motivated, because we don't have very many options for them? And so here comes, do I feed you? Do I give you more time off? Do I increase your pay? Do I give you some type of incentive? And so in those areas, yes, we do have to think outside the box. But it also, I think, goes back to when we talk about managers, and you brought up a good topic, is how do we continue to encourage our managers to utilize the tools that they have learned throughout this situation? I think that managers had to really think outside the box. You give them lots of tools, but they never really get a chance to use them until you're in crisis mode. And so when we were in crisis mode, we learned how to go and think outside the box. And so we need to make certain that we're encouraging those managers to continue to think outside the box, utilize those things that we have now put into place, and to continue to make that difference. So when we're looking at the OR nurse, well, how can I continue to incentivize that OR nurse that I have to come to work every day and provide that service? Then we can think about that one-on-one conversation. How are you doing today? We're also offering our employees some mental conversation that they would not have ordinarily had. We also are reaching out from the child care perspective, because if you're at home or you have children at home and still can't go back to school because of COVID situation, how do you manage that? And so we're giving those managers those tools to maybe advise their employees, because we still have communication issues that don't always go down to the bottom. And so we're trying to force people to continue to communicate, but force it down and let them have that tool that they can see and use. So I know I'm kind of going around the bend there, Tracy, to answer your question, but a lot of it, we don't have that flexibility in healthcare. And so we have to use all other types of incentives to encourage our employees. But one thing that's different about healthcare is that you're a nurse because you want to be a nurse. You're a nurse because you have it in your heart to be a nurse. I'm not a nurse because that's just not my field. And so when they come to work, they're here to really provide for the patient. That's their number one goal. And if they get tokens or pats on the back, as we do and try to do, I think that is what makes our staff more engaged and are willing to stay here, because they come with already that need to give and that need to nurture and that need to care and make people better. And that's their reward at the end.
Beautiful response, Adrienne. Thank you very much. I loved it. I want to do a partial shift of gears here, and thank you for those responses. They were excellent, great ideas. And talk a little bit about employee expectations and have those change to the degree that we need to be concerned about these. And how do we address those? How do we call this contract realignment. How do we realign that contract that's now been completely violated or completely, how do we realign that? So Darren, I want to ask you to start with, if that's all right, some of these employee expectations and some concerns.
Yeah, one, I don't know how all the expectations are changing yet. And two, I definitely don't have any silver bullet or any bullet of any kind around how to realign them. The things I'm seeing or that we're seeing that are changing or that are likely to change. One, continuing everything that's in crisis mode. But all the things which people are getting great value out of, but an expectation that they should continue. And so I'm worried about if you turn down one of those or disconnect it, what type of disproportionate effect does that have on their overall experience? I don't know. But the big one is back to flexibility again, is, I'm seeing we're getting more and more people going to, I think I don't want to ever come back to the office. So I don't want to, I want a change of contract, permanent change of contract around flexible virtual working. And when we ask questions around, well, okay, why? And the first level of response is, I'm worried about safety and COVID. And I think that is legitimate for some people. But I would also say, it's pretty early to decide with that much conviction that things won't change, considering how much things are changing on in some cases, daily basis. And then I'm seeing, you might probe a little further and it's, wow, I think I just like it. better at home. I can, my commute's gone. I don't have the train fare I normally have. I don't pay for car parking. So financially, I'm a little better off too. And I can see that. And then I see almost double click on what people are starting to ask for, which is, I think I want to work in another country. So I never want to come in to the office. 2, I want to do my work, but from another country. And or maybe not even another country, but it could be 400 miles away from the office. And the triple click expectation is, and I want you to pay me. If you ever want me to come into the office, I want you to pay my expenses. And so I'm worried about a pendulum swing, it's right now, I'm not seeing any kind of moderation of the swing. We just keep swinging from extreme to extreme, and a set of expectations which are pretty binary. I agree with Trent that in the future, maybe not that distant future, there will just be a different, more hybridized version of flexibility. It will be less binary of I either work in an office or I don't. Which is how I think people view it today. Certainly what I'm experiencing right now is people want one or the other. And the request I'm getting is to not come to the office. The thing that leaves me worrying about is I believe the office is an important part of culture. I don't think we're going to need everyone in the office every day, but I do think people need something to hold some identity with. And if I think about, we've hired, there's not huge numbers because we're not a big organization, but we've hired 52 people since March, who have, in most cases, never met another Calypso person in the flesh, and in all those cases, not stepped foot in a Calypso office. And part of what, I believe what we associate with our culture, part of that is the environment. Part of our tribe is this. And so I'm worrying about if we do move to a pendulum swing of far more remote working and only remote working, which I don't see for us, but I can see for other companies, I worry about like culture decay, like this slow erosion of things which are really valuable to us right now. So that's kind of how I'm thinking about it.
I think that's an excellent explanation. I am here in our office, and normally in the past, you would have seen, the 20, 25 people running around here during this conference call, and we haven't seen anybody. Had a good conversation on yesterday was along the lines of, okay, one of the things that we're able to do right now is we have this culture that's already there, and people are now taking that to their homes, but they're still part of that tribe, that initial tribe that they learned when they joined our organization. Now, when you start bringing people on, they don't have that benefit of having been part of that tribe and know that culture to take back. So how do we deal with that? Interesting concept. Trent, can you tell us a little bit more? What do you worry about in terms of employee expectations, or what do we need to be aware of?
Yeah, I'd probably go back and forth between Adrian and Darren on this. I think there's some things that we don't fully know how they're playing out yet, but I also think there are some things we do clearly know. I think, one thing I want to hit on what Darren said and just emphasize it. I think one of the biggest things that all leaders need to be thinking about right now is, what is the future going to look like? Because I think we all have to be thoughtful about, we've started doing some work around creating personas of a full-time work remote, like Darren said, a full-time work in the office, and somebody that's a hybrid. And how do I need to think about that from a pay perspective? I know some companies are looking at, well, you don't come into the office, so I'm going to pay you less. Or you live in a rural or remote area, so I'm going to pay you less. Well, does that work on the flip side? Do I have to pay you more if you're in New York City, right? So, these are big things that we all need to start thinking about. We need to be thinking about, what is that level of flexibility that we will have in terms of where you work? We've started having discussions about, states, and which states would we be okay with having a remote employee with, and are there others that maybe we wouldn't? So I think those are things that we all need to be thinking about a lot. One question that came up on the board was, how can organizations systemically manage productivity of remote workers? I can tell you, I think that we've got to figure this out. What I like about what's happening is it's changing from an activity-based to an outcome-based, which I love. I think that we need to be thinking about that as leaders. How do we hold people accountable to outcomes? And my hope is that this remote helps us think about that. So at the end of the day, we don't care. We don't care how you get it done, as long as you do it in a certain, in a respectable way, consistent with whatever the company's values are. But we need to be thoughtful about that. And then the last thing I would add with the remote employees, or just our employee expectations, is I think that, I'm struggling with this question of how do we maintain our culture, or continue to evolve and drive our culture intentionally versus just letting it happen by employees doing whatever, right? And I think this is $1 million question. And I think the companies that figure this out, how do we maintain a culture, an environment where a lot of employees, a portion, maybe half or so, are working remote. I work in a unique environment because I have half my employees are in our branches working with members, and half are corporate. And so, we do have to have different levels of flexibility. To Adrian's point, I'm glad you don't have flexibility in the OR. Thank you. Financial institutions, we've enabled simple things like shift swaps, and they can manage it, right? It goes back to that principle of consumerized tools that enable them to do their job and have flexibility. But then corporate, it's a different discussion, right? We started to tailor our engagement surveys where we check, is this for a remote employee or a branch employee that's in the office every day? So I don't know if we have all the answers, but what we do know, I think, is a true statement, is the employee expectations are going to continue to evolve. What I would say is I think we need to be thoughtful right now and intentional about how do we want to maintain our culture and enable flexibility, because I think those companies that do it well, they really are going to win. I think you're going to see a great sifting over the next couple of years for companies that just stay hardline. They manage to the traditional, they manage to the old school. I think they're going to hurt because you're going to get more and more employees say, why would I keep doing this when I can go work for X, Y, or Z that does it different?
Correct. Just to chime in from a healthcare perspective, I'm sorry I may be jumping out of tune or position here, but listening to everyone, of course, in healthcare, you have a different perspective. Is everybody's expectation is that you are here every day. The challenge that came up to us and that we're going to have to really look at in the future is healthcare is used to coming together. Healthcare is used to face-to-face conversations. When you're consulting over a patient, it's a group discussion. Now, because we have social distancing, we can't do that. Our technology is not the best. Well, we're learning that we have to go back as a healthcare institution when we're so used to verbal and face-to-face communication that we can't do that any longer. So we're having to learn that our housekeeper down in our housekeeping department doesn't have a computer. They don't have the technology, but I still need to communicate with them, but I can't put them in a big room anymore. We're also learning from an administrative standpoint is I can't have a 300 person meeting with all of my leaders, but my leaders don't have the technology that they need in order to better communicate. So it puts a different perspective for us in healthcare is that we don't have the tools to properly communicate the way that we need to. Our CEO puts out email every night to give us an update on what's going on. But if it's only reaching 75% of my employees, what good is that communication going to do? So we struggle differently in healthcare when it comes down to technology and also keeping our communication open, because that's the expectation that we set now for our employees, is that we're going to tell them moment to moment what's happening, how things are changing. But if we don't give them the tools or the resources to be able to get that, then we're losing that engagement with our employees.
Great points. Excellent point. So while we've been talking about intentional communication and intentionality, there's a barrier to that intentionality. We know that's a solution, but the problem is we may not have some of that ability to make that happen.
That is correct.
I guess that makes Liz our concluding speaker here.
Oh, no.
Liz, I'll give you about 2 minutes, if you wouldn't mind, to kind of give us any words of advice here when we're talking about leaders and organizations and what's really working. What would you recommend? How do you steer your organization as an HR leader within your organization in one that focuses on talent development?
Yeah, it's interesting because there was a question that came up in the chat about managing stress, and obviously working in the talent development, in the learning field. Learning is something that's really important to us internally, and I think we have made a shift, both organizationally driven by HR, but that we then expect of our managers, where we say like that development that you're doing with your employee. Yes, there is we need to continue to drive business, to Trent's point. But when we think about the flip side of that on the engagement, taking care of that whole person. And so maybe instead of that conference, because you can't go to it because it was canceled, where you were going to grow in your field, maybe that learning is a course on mindfulness, and valuing that kind of learning and development in the same way that we valued, you're going to go learn how to code in a new language, and really making sure we prioritize that whole person development and the learning that is necessary in these times that we're just figuring it out. It changes every day. But pushing that down to the managers and making sure that they understand and are representing to their employees how important taking care of that learning is at all levels and for the whole person.
Wonderful. Thank you. Excellent. Well, there's so much more we could pull out of each one of you, and I wish we could have the opportunity to do that. I want to thank you very much, panelists, for being part of this and sharing your knowledge and candor with us. I want to thank the participants of this. Justin, with that, I want to turn the time back over to you. And again, thank our panelists. Wonderful job. Excellent job. Thank you.
Great. Thank you all for everyone. We really appreciate it. Again, this webinar is on demand along with all of our other webinars, and we encourage you to watch those. And until our next one, thank you, and we'll see you soon.